demand for coronavirus tests is up to 4 times higher than the number of kits available, the Test and Trace boss has admitted. Baroness Dido Harding faced a grilling from MPs after figures revealed just a third of people who fear they are infected get results within 24 hours. A total of 18,371 new people tested positive for COVID-19 in England in the week to September 9, a rise of 75% on the previous week. The proportion of in-person results returned within 24 hours plunged to 33.3%, the lowest since the week to June 17, when the figure stood at 31.3%. Only 1.9% of people in England who used a COVID-19 home test kit received their result within 24 hours, the lowest percentage since Test and Trace was launched at the end of May. Baroness Harding told the Commons Science and Technology Committee there was capacity for 242,817 tests, but the number of people seeking tests was 3 to 4 times the number available. The Tory peer claimed nobody in government had been expecting the really sizable increase in demand we've seen over the past few weeks, despite millions of children returning to school and mammoth effort by ministers to get people back to work. She said, "There's significantly more demand than there is capacity today. The best way we have of estimating the total demand at the moment is the number of people calling 119 and the number of visits to the website, but that is not completely accurate. The number of people calling 119 and visiting the website would be 3 to 4 times the number of tests that we currently have available, but there will be some double counting in that. People will call from their home line and then from their mobile." She said people were coming forward for tests if they didn't have symptoms. Some 27% of people polled by Test and Trace said they were at the test center because they had been in contact with someone with symptoms rather than having symptoms themselves. Coronavirus outbreak. Baroness Harding said there had been a very marked increase in the number of young children coming forward. A doubling of the number of children under 17 coming forward to be tested, and more than that in ages 5-9, she said. She confirmed ministers will ration tests by prioritizing hospital patients, followed by social care and NHS staff, then testing in outbreak areas. Among the broad general public, Lady Harding said, "We are looking to prioritize, within that, key workers, particularly teachers." Tory Chairman Greg Clark criticised the government's efforts. The ex-cabinet minister said, "It is dispiriting to find that we are now in September, in circumstances which are entirely predictable. People are going back to school, people are going back to work, and we haven't had the right capacity put in place during the quieter times of June, July, and August." Poll loading. Should there be an immediate inquiry into the government's handling of coronavirus? 3,000 plus votes so far yes, no, but Baroness Harding said the problems in the system were to do with lab capacity rather than at the testing sites. It would be very dangerous to send too many samples for analysis when they cannot be examined in case they go out of date, MPs heard. She said, "We have to restrict the number of people who are taking tests in the testing sites so that there's no risk of those tests going out of date when they are processed in the labs. So I do understand how frustrating it feels that when you arrive in the testing site and it doesn't look like it's very busy and you can see it could do more, but the capacity constraint isn't in those testing sites, it's back in the lab." confronted with the time it takes for results, she claims, "We have seen test results take slightly longer than usual." Close quote. The Bureau added, "For some people, the testing turnaround times have gone out a bit." Close quote. But she told MPs, "I strongly refute that the system is failing